So here's an example of a first-degree indicator, and it can relate to residual effects of system abnormality. So if someone has a mild indicator, it can suggest that medical tests cannot detect anything yet because it is so mild. It's something that could be related to the past, and the indicator is just showing a scar or a shadow of something that happened. Or it can relate to something not yet physical in the plane, but qualitatively 10 to 20% of a body system out of balance. Okay, so that's how we quantified mild. Okay. So, and I classified the indicators like a burn, first, second, and third degree burns. So here's your examples below of first degree indications: IBS, allergies, high blood pressure, past surgeries. Second degree is when a conventional exam should detect something at this point, and it's greater than a first degree threat. Now we're moving into 20 to 40% of a body system out of balance. If you recall, with the breast, I said there was a breast indicator but shouldn't get any worse. So here again, it was moving into, could be cysts or tumors, benign or malignant, could relate to heart disease. And then here's your third degree, where we're getting into qualitatively, more than 50% of a body system out of balance. And examples include invasive metastasizing growth, cardiac arrest, any kind of condition or health that could lead to death. But again, people can have a neurological or cardiovascular indication third degree for a long time. Doesn't mean they're going to die in the next week. But it's just telling me that's how they're going to go, unless they take steps to avert that. So then, once we established those parameters, then the study resumed, and then this is how I would report information. So I said there was a second degree genital urinary. This person had an enlarged prostate with a history of sexually transmitted disease. Okay. First degree blood, no, there's a reason you don't have this one, because there's a little mystery at the end. First degree blood indicator, and I specifically said, and it relates to high blood pressure. I was going for as specific as I could be in the study. And patient was diagnosed with high blood pressure. Here is an example where a first degree indicator related to past surgeries, and the person had a history of vision correction surgery in their eyes. Yes?
What is the eye indicator?
That's something I have not been able to depict necessarily in an illustration. Okay? Okay. I'm only, and I can't go into celebrities right now on camera. I said that there was a second degree cardiovascular indication, but in this case there was no finding, so that would be a miss. But again, I'm picking up on what might be brewing, as Dr. Manny would say. I said that there was a first degree spine indication, and they had degenerative disc disease and chronic back pain. I said a first degree gastrointestinal. They said there was nothing known. Now, the last one, I said there's a breast indicator. So is there anything unusual about this particular patient?
It's a man with a breast indicator.
If we have a man with a breast indicator, yeah. So the patient's got a prostate and a breast indicator. And I've pardon me?
Is it,
Well, and I'm in the study saying to myself, okay, I need to get the best score possible. And this guy has a breast indicator, but I've never seen a man with a breast indicator. What do I say? Do I say it? Do I not say it? I want to get the best points in the study.
Any corrective surgery.
So at this point, one of the doctors came into the room when I was examining this gentleman, and he said, "Hey, how's it going?" And I said, "Well, I'm just going to be honest with you. Regardless of the study, I'm looking at a man and I see a breast indicator, and I've never seen a man with a breast indicator before. Don't really hear about men having breast cancers or mastectomies, or well, I'm just okay. I understand it's possible, but I haven't. None of my friends. I'm just saying, nobody I know. And then that's when the physician said that they have gynecomastia, which is a side effect from some of the medications that, if I remember correctly, was for the high blood pressure or something with. Medications, it was known that gynecomastia was a side effect. So he said, in that regard, you're correct, because it did result in gynecomastia. So it was just a surprise for me in terms of I just had never encountered something like this before.
So
was an indicator, but nothing at the time was going on with the breast.
He had gynecomastia,
Okay.
He had a condition.
which is male breast enlargement, is my understanding. Is that correct?
Yeah.
Okay.